I don't think it's one thing. I don't think it's one issue that stops people. It starts. So I'm very proud of the fact that whatever I was doing in the UK, I'm able to do all of that medical science technology delivery sitting in Mumbai. I'm extremely proud of that as an Indian. There isn't much that we don't offer here, in epilepsy surgery, and the various treatments. But what is different is, I think, the way we look at epilepsy as a society. So it's not only patients and their relatives accepting epilepsy, it's how much it starts right at the top. It's taken ages for our government to recognize epilepsy as a disability. Even right now, it's clubbed with some 7, 8 mental disabilities. So it doesn't get any special treatment when it comes to various government schemes. Um, and I genuinely do think change starts there, right? I mean, you bring it you bring in changes at a policy level, then for them to seep through, gets accelerated through the whole system. So I think the game changer will be our having policy level changes for epilepsy. I'll give you a couple of examples how policy level changes cause real life problems. So can you we get asked a question saying, can I drive with epilepsy? Sitting in UK, I had a very clear idea. Their RTO, which is called DVLA, has very clear guidelines as to who can drive, when they can drive. There was a nice system in place, wherein all my patient consult letters would directly go to the DVLA, so everybody's in the loop, and we know which patient we think is safe, medically safe to start driving, and for whom it's not safe. So care is taken around it. When I came back to India, I was trying to search and search, saying, India में law क्या है भैया, कर क्या सकते हैं? Can I allow my patients legally to drive? Once of course the medical thing is taken care of. We have a extremely archaic. We have a 1936, if I'm not wrong, a pre-independence law about driving and epilepsy, which says if you have epilepsy, you can never drive in your life. Now, does this get reflected in the form that you fill when you go to get a driver's license? No, there's no question which asks you saying, do you have epilepsy? I mean, and we are in 2021. So this is one. So what do we tell patients? Where is the patient and me? Where are we medico-legally when it comes to something as common as driving? Which affects people's lives quite. Okay, Mumbai, maybe you will get away with public transport, but in smaller towns, or just as an idea saying, okay, so what if I have epilepsy? I should be allowed to drive. If I'm medically declared fit to drive, the legal system should support. You just don't get that. There is just no clarity around it. Second issue is insurance and epilepsy. Till a few months ago, majority insurance companies had epilepsy as an exclusion criteria to support medical treatment. And we are talking about a disease which is, the WHO says it's 1 in 200 is the incidence of epilepsy. We think it's more in India, given our poor perinatal health and all of that. But you're talking about a 1 in 200 disease which is not covered by insurance. So it's just becomes so many things become difficult. So I think we need policy. One game changer will be the government standing up, giving epilepsy a similar status like, say, cancer, or whatever else it is. It's up to the experts to say how. But I think a policy level change at the way we look at epilepsy, at the way we treat epilepsy, is what will be a game changer, like an epilepsy act or something like that. Which covers all these aspects, gives direction to various agencies involved as to how should the society, how should various administrative bodies help out people with epilepsy. And it's not only helping, it's also saying, if you have active epilepsy, for example, don't drive. You're putting in safety for all road users. And I'm just using driving as a small example. It's so many other things. It's schooling, it's jobs, it's insurance, like I said, so many other things. But what we need is an epilepsy act.